Hi, this is Dr. Kevin Smith, and this talk is about what to expect at your first visit. This is for anybody that has been currently suffering with chronic knee pain, or if you have joint stiffness, or if you have crunching and popping noises, or if you have experienced pain with walking or extended standing, or maybe it's miserable going up and down the stairs. Even if you've been diagnosed with bone on bone, or your doctor told you that your knee needs to be replaced and that's your only option. This is the big picture of knee pain. If you're going to pay attention to any of the slides in this presentation, this is the one to pay attention to. Altered neurological control leads to abnormal movement patterns that leads to chronic pain and inflammation. This is the nervous system. This is composed of the brain, the spinal cord, and the nerves that go down your arms and go down your legs, also known as the peripheral nerves. In your low back, you have 5 vertebrae called the lumbar spine. And in between the vertebrae, there exists 5 pair of spinal nerves. 5 exit the spine on the right side, and 5 exit the spine on the left side. These nerves go down your legs to control your knee joint. They provide sensory and motor control for your knee. Each peripheral nerve has 9 internal fibers. 2 send pain signals up to the brain. 4 controls your muscles. 2 controls your blood vessels. And 1 controls balance and touch. This is important because abnormal peripheral nerve function causes weakness, cramping, restricted range of motion and stiffness, restless leg syndrome, balance problems, cold feet, and abnormal movement. Which drugs do you have to take to fix abnormal neurological function? The answer is that none exists. Your knee is known as a hinge joint. It's no different than the hinge on your door. The knee is composed of 2 bones, the femur and the tibia. There are 2 more bones called the patella or the kneecap and the fibula. Those are for the attachment of muscles, but they're not actually part of the knee joint proper. The normal knee movement is controlled by 12 muscles. 6 of them are in the front of the knee. They control extension, and 6 are in the back of the knee. They control flexion. There has to be an organized concert of movement. All the muscles need to work together harmoniously. Your body learns patterns of movement over time, good or bad. What's going to happen to your knee if your body only knows abnormal movement patterns? You're going to have accelerated wear and tear, chronic pain, and inflammation. It's kind of like this bald tire. Well, would changing the tire fix the underlying root cause of the problem? No, it would not. What caused the abnormal wear and tear on the tire? It's caused by an alignment problem, the same as your knee. What drugs fix abnormal movement patterns? The answer is there are none exists. The knee inflammation involves arthritis, tendonitis, bursitis, wear and tear, and chronic pain of the joint. Pills and injections, they are the most common therapy for treating inflammation and chronic knee pain. Many of you have tried the 800 milligrams of ibuprofen or the cortisone injections. But why do you think that medications fail to provide a permanent solution for chronic knee pain? The answer is that it doesn't address the first 2 causes of the problem, which is abnormal neurological control and abnormal motion patterns. It only affects the chronic pain and the inflammation. For permanent relief of your problem, we have to restore neurological control, we have to reset the normal motion, and we have to resolve the chronic pain and the inflammation. To restore neurological control, we use a Neuromed. This FDA-cleared medical device restores, rejuvenates, and enhances normal neurological function, such as motor, sensory, and balance control. To reset the normal motion, we use a therapy called Trigenics. This is a type of sensory motor therapy that gets powerful results, resulting in better range of motion and a decrease in pain. To resolve the pain and inflammation, we use laser therapy. When our powerful laser reaches the target tissue, it provides massive relief from pain and resolves your inflammation without drugs. So your next simple steps involves to reserve your spot, get a consultation and examination, a report of findings, and my professional recommendations. We need to do a comprehensive exam to evaluate you for neurological function or dysfunction, do some orthopedic tests, and check your muscles to see if they're working correctly. Bring the person closest to you. The reason why we ask you to do this is that they will be participating with the exam, and they will be providing us with great insight as to what kind of challenges that you're having. If you're married, the logical thing is to bring your spouse. If you're not married, bring somebody else. Bring a friend, a sibling, or a child. After the exam is done, we generate a report for you detailing the results of your examination. We will let you know if we can accept your case, and if we can, we will give you our best recommendation that will help you to achieve your goals. This is affordable care. Our typical patient is a 78-year-old widower living on a fixed income. If that person can afford it, anybody can. We guarantee results within one treatment, or we won't accept your case. You have nothing to lose but the pain. Make sure that you arrive at least 15 minutes early for your appointment. Make sure that your paperwork is completely done and that you're wearing shorts and a t-shirt, because I'm going to be doing a neurological examination and I may need to move you around a little bit. This is Dr. Kevin Smith. Thank you very much for watching this video. I look forward to meeting you and doing your knee pain exam. Thanks. Bye-bye.